everybody. It's Stephanie Baker with Life in Abundance, and we are back for an episode of On the Couch. As always, I want to remind our listeners of the main three reasons that we do this podcast. The first is that we want to be able to talk about relevant counseling topics. We are a faith-based nonprofit that offers biblical counseling, pastoral counseling to families in the upstate, because we believe that by strengthening families in the upstate, by offering counseling, we are strengthening families in the upstate and making our community stronger. And so there's a lot of mysterious stuff sometimes that people think that goes with counseling. And we want to sort of take some of the stigma off of counseling. There are a lot of negative connotations to that. We want to address topics that are current. We want to address things that even if you may not be questioning them, you may know somebody that is. And so we'll be talking with counselors that are on my team, but also counselors in the community who have varying specialties in different areas. And one of the other reasons that we do this is to spotlight other ministries, because they may have resources available to you that you're unaware of. And so we want to take time and do that whenever we can. And the other reason that we do these podcasts is to focus on functional medicine and functional nutrition, because we believe at Life in Abundance that we are triune beings, body, soul, and spirit. And so we know that there are physiological things that can go on that cause us not to feel our best. So it's not always an emotional thing. Sometimes it's a physiological thing. And so we are talking about all kinds of different topics in the area of functional medicine and functional nutrition. And if you've been following our podcast for a while, you'll know that I actually have interviewed a number of different functional medical and functional nutrition providers. So they're always interesting to talk to. And today, what we're going to do is talk to a recurring guest, and he's awesome. His name is John Nolette, and he is with Restoring Hope Counseling in Anderson. John is a licensed professional counselor, or an LPC, by the state of South Carolina. And his focus is actually on working with teens and children who have neurological or neurodevelopmental disorders. He also works with families in the area of parenting strategies to help maybe walk through some of those tough scenarios that come with the neurodevelopmental disorders. One side note before we begin with John, and that is that I am not licensed by the state of South Carolina. I'm what is known as a clinical pastoral counselor. And so with that said, John, welcome back. We're glad to have you. Thanks for joining us again today.
Thank you, Stephanie. Thank you for having me back. It's great to be able to speak with you again and provide some insight into our topic today.
Awesome. Well, what we wanted to talk about today is a very, very broad topic, and there's a lot that we could go into. I have a few questions that I think maybe our listeners might be interested to hear your answers on. And we want to talk today about the topic of autism. Now, you have had quite a bit of experience in working with youth who are walking that journey with autism. And I would like us to talk, maybe first you can tell us a little bit about what autism actually is. Let's define that.
Okay. So autism is a neurodevelopmental disorder, typically that begins kind of at birth to the first 2.5 years of life. So typically it is kind of an early developmental diagnosis when we think about when that gets diagnosed. It typically involves kind of persistent deficits in social communication or social interactions. And then oftentimes you see kind of restrictive patterns of behaviors or like ritualistic behaviors that they continue to do. And then there's typically along with that some sensory sensitivities or sensory input issues that people with autism display.
Okay. So you said that it's usually around the age of 2 that it can be diagnosed?
It can be diagnosed as early as kind of 18 months. Typically,
Wow.
you can see kind of some of the symptoms, some of the behaviors and different things start to develop very early on. So young children, these are kids who can kind of be, if it's detected early, can kind of go through the process of some of your early intervention therapies and skills and kind of be working on some of those things early on to try to bridge some of those gaps.
Okay.
Similar to other neurodevelopmental disorders like ADHD, the earlier you catch on to it, kind of the more you're able to kind of, the gap is not as large at that point, and so the deficits are not as severe. The other thing with autism is sometimes, kids are very resilient, and so in that they can learn adaptive skills to kind of help them manage being in certain environments or certain skills to get through. And so until the environment becomes more challenging than their skill sets, you oftentimes don't even see that. And so it can
Wow.
be picked up in as early as like 18 months, but there's people that even through adulthood are being diagnosed with autism.
Okay. That was maybe just missed when they were younger.
Yeah, again, you'd want to focus on, because it's a neurodevelopmental disorder again, and because it's kind of early developmental stages. They do questionnaires, or they'll do some rating scales, and some of that will be about things from childhood or different things that you experienced. So if they're doing that with an adult, it might be interviewing the client, or it might be interviewing other people who would have kind of been part of their lives. If it's with children or adolescents, they'll probably do rating scales and interviews, much like ADHD, with individuals who interact with them often. So parents, caregivers, teachers, if
Okay.
they've got a sports team or things like that, they want to interview multiple people to kind of get a good rating of overall functioning.
More comprehensive picture of what's going on. Okay. All right. So let's say that I'm the parent of a young child. I think you were even mentioned at one point 18 months. What might I see even at 18 months? And I
Yes.
don't know
So I think with the younger ages, oftentimes what you might see is there's some developmental delays in their speech.
okay.
Oftentimes they're looking at communication skills, so that can kind of be a warning sign or something to look out for, that they're not developing those skills at the level they should be or at the rate they should be. Nonverbal cues. So oftentimes with nonverbal cues, we talk about eye contact.
Mhm.
That's a big one with autism spectrum disorder. They avoid eye contact often, or other nonverbal cues that are not responsive to kind of like someone else's facial expressions or emotional reaction. Speech, if they do have speech at a young age, it can kind of be monotone, it can be very restricted, and so those would be some of those things you want to look at. For behavioral things, oftentimes they can have a lot of irritability. They can have gastrointestinal issues. there can
Wow.
be um, there can be difficulty with play, and so they'll do a lot of parallel play. They'll play alongside kids, but they don't interact with those kids,
Gotcha.
or they'll play with toys in different ways. So like the example I've always used and always heard is, like, you'll see that child who lines up all their cars but then doesn't actually play with their cars. So the way they're playing with those things is not like the normal kind of typical way you'd see kids playing with those things. And again, a lot of it's based on the severity of needs and like what's going on with that. So because it is a spectrum disorder, it means you can have a range of skills and abilities for individuals even as they fall on the spectrum, and you can see a lot of kind of like what would be typical developmental things that children are kind of working through and adapting to as they age.
Okay. So, and you mentioned that when it's diagnosed, the professionals who are doing that are looking, they're going to want to get a comprehensive picture really from multiple people who interact with said child.
Yep.
Who are the professionals that I go to as a parent if I suspect that this might be going on with my child? Where do I start?
Yeah, so I mean, oftentimes you would think you want to go to your doctors. Most pediatricians aren't specializing in autism spectrum disorder. And so from there, you'd want to refer to like a developmental pediatric office. Greenville has one in the upstate. There's a few others kind of throughout the state of South Carolina.
Okay.
Um, they typically have very long wait lists for the developmental pediatrics. And so oftentimes that can be the struggle of how long do you wait for that? What can you do besides just going to a developmental pediatric? And so you can find specialists in other areas. Sometimes you can find some child psychologists or child psychiatric services that specialize in that. Early intervention services, sometimes you'll get speech therapists or OT, so occupational therapists, who work with individuals on the autism spectrum who specialize in that. And so, again, that's another route to kind of explore with early intervention skills and services. But oftentimes, you want to go to someone whether it's a psychologist, a psychiatrist, or developmental peds who would specialize in that. So they've had training alongside other specialists who work with the autism spectrum disorder.
Okay. All right. And so then from there, they will guide next steps.
Yeah, I mean, like in any process, you want a team. So I think you really want to be able to build a comprehensive team around the family and the child or youth, or even adult in this instance. And part of that's going to be based on their individual needs. So
Right.
just because there's behavioral related things or social um, related things, or even some communication skills that can be deficits in those areas, doesn't
Mhm.
mean everyone has it to the same extent. And so oftentimes you want to look at what level of functioning are they and what supports do they need, because that's going to determine maybe what services get set up, what's recommended for follow up, typically what else they're going to kind of incorporate as part of treatment options.
Okay. So, what are some common challenges that persons with autism might face, young people might face in school and social settings?
Um, so oftentimes when we think behavioral, like these are children or adolescents who can have aggressive behaviors. They can have self-injurious behavior. So they might be the kids that you see like banging their heads on the floor, banging their heads against walls. They can pick at skin even. Uh,
Mm.
they can have a lot of repetitive movements with their body. So
Mhm.
they struggle with that. Social issues from not being able to maintain friendships, not really playing with other kids, because of some of the communication issues or deficits. There can also be a struggle in some of the language, and so being able to communicate clearly with other people. Um, Typically, you see like a hyper focus on specific details or interests or hobbies, where it goes beyond even just, it's kind of abnormal in the intensity or frequency of those hobbies and interests. And so in schools, this might be a child who they just want to learn about the Civil War and they don't want to learn anything else about history. And so when they're in one of these classes, all they're focused on is this one topic and they don't move on to other topics. And so they can kind of get stuck in those patterns of what they're focused on learning about. Um, it can also be that these are kids that don't really get challenged in certain areas of schooling. And so, again, they can have strengths in terms of kind of some giftedness. And so,
Mhm.
that when you talk about like math or mechanical
Mhm.
um, skills, when you talk about their ability to do like rational um, patterns and things like that, they can be very observant and very focused on those things. So they can excel in those areas. But again, English language arts, reading, some of those other areas can see some deficits. And so there's kind of two categories in that, where that same person can have really great skills in one couple areas of schooling and academics, but really struggle in other areas of academics. And so making sure they don't fall through the cracks in terms of what services they need, but also being
Right.
challenged in areas that they excel in.
Yeah. So going back to you talking about a team, it would seem that everybody would need to be on the same page, including and specifically the school that they're attending. What are some of the, in your experience, what are some of the capabilities of the schools to be able to interact with these kids in a way that is helpful?
Yeah, so I think a big part of that is behavioral analysis for the schools. So with that, kind of they do functional behavior analysis as part of like ABA services, so applied behavioral analysis. With that, what they do is they have someone who comes in and observes the child or the youth in classroom settings and in multiple classroom settings. So it's not just their homeroom or their related arts. It might even be at lunch or on the playground at recess. And what they're looking for is they are looking to observe the behavioral functions of the child in those different settings and how they interact. And then from that, they kind of really build out kind of a treatment plan and what they're going to do in terms of a behavioral intervention plan. And so
Okay.
that really becomes crucial, especially when we're talking about autism spectrum disorder, in kind of the ability of children to function in the school setting. Because again, they can get very stuck on sameness, routine,
Mhm.
inflexibility,
Mhm.
um, and adaptability, which often is required for students because throughout the day
Right.
in the school, you're required to
Right.
learn what someone else wants you to learn. You're required to do it when they want you to do it, and you're not in charge of any kind of the time management or when you can and can't do certain things. And so that can be very difficult for children and adolescents on the autism spectrum to kind of function in that environment. But that routine is also very helpful, especially when it's followed through with and there's consistency to that. And
Right.
so again, when there are moments, so you do see some of these kids who, when routine gets changed or something kind of sudden happens, there can be kind of some of those outbursts or some of those behavioral issues. And so being able to kind of regulate them, being able to calm them down, being able to get them to kind of being able to move forward, because a lot of that comes from the anxiety portion of that. So there's a lot of anxiety that comes with those moments. So an example could be like if a fire drill suddenly goes off. If you haven't planned that out with the child on the autism spectrum disorder, that can turn into a disaster.
Yeah.
And so a lot of pre-planning, a lot of when there is adjustments, making that clear, and a lot of behavior management strategies come into play in the school systems with positive reinforcements. So we talk
Right.
about that a lot with some of the neurodevelopmental disorders, especially with kids with behavioral issues. You do want to positively reinforce the behaviors you're trying to get them to continuously work on, instead of just focusing on negative behaviors. And so when they can kind of work on that and there can be a good system in place in the school systems, plus
Mhm.
observations that have been done to really come up with a good behavior intervention plan, I think it helps kids be successful.
Yeah, that's very important. So as a counselor, you work with parents also, with parenting strategies. What are some of the common things that you hear from parents who have kids that are struggling with autism?
One of the most common things is I have to repeat myself over and over and over again. And so, as a parent of three kids, age ranging from ages 9 through 13, I have to repeat myself all the time with my kids. But I think with parents of children with autism spectrum disorder, it's even worse for them because they feel like even simple tasks they're repeating themselves over and over and over again. And there's kind of an expectation put on that. I've said it several times. They know the routine, they know how to do it, but they constantly need to be reminded. And so they have a routine, they focus on sameness, but oftentimes the time management portion of that, of when we do those things, how we need to do those things, even breaking down tasks can be very difficult because it's not the same. And so again, based on intellectual functioning too, there can be a big difference because oftentimes another thing that's associated with autism, you oftentimes see them have lower IQs or intellectual disabilities. And so there's some cognitive processing and then just overall IQ functioning for people on the autism spectrum that sometimes can play a big part in that, in terms of their abilities and their skill sets and what they really know how to do.
If I'm a parent right now that thinks that my child may be struggling with this, what would you say to me?
I often recommend for parents to get into some services, so whatever they can, whether that be counseling, and with the counselor, be working on how do we build out support systems and make referrals to the other providers that would need to be part of that team in order to get further assessments. Because again, there's interviews. Part of the process of diagnosing is interviews, questionnaires, the rating scales. There are some specific assessments that can be done for autism. But again, you'd have to be trained. You'd have to be a provider who's trained in those specific assessments. And so again, you want them to get those full range and comprehensive assessments done. But at the same time, I think even going, there's value in going to counseling as a parent if there
Mhm.
are concerns, because you can start working on some of the skills that you may need to kind of adjust and be able to be adaptive and flexible with, knowing that there's going to be some of these struggles. And so it helps you be able to kind of start scaffolding some of the skill sets that you need and building upon things that even within the home you need to be focused on.
Yeah. Um, I don't know that there is an answer to this. Obviously, we know it's a neurodevelopmental issue, but what does science tell us about how this happens, like
Uh,
root cause?
yeah, so it's not always genetics. There are some kind of genetics disorders or syndromes that they do believe kind of can play into children who develop autism. So Fragile X is usually one that kind of, if they see Fragile X, they often will be concerned that there could be kind of a diagnosis later on of autism spectrum disorder or intellectual disabilities. There's some people who look at it as like it's an environmental thing, but I think overall, it's just, again, much like ADHD, the brain is wired just slightly different for these individuals. And so you've really got to just be able to learn and understand how they function in the environment and some of those skill sets and be working towards building skills for the individual to be able to function and thrive.
So, what do you say to the parent that feels like it's their fault? How do you work with parents who have guilt that they've in some way caused this?
Yeah, guilt and shame are really powerful emotions, right? And so I think even for adults and parents, it becomes one of those things of that really becomes something a parent, like you as a parent, need to work through that you had nothing to do with this, right? In many instances, but you can start now and working on making sure that your child learns to thrive in certain environments. And so again, I think when guilt and shame take over, they kind of really stick us in the past, right? So it becomes,
Yes.
it's kind of like when we're working through grief. Like if we get stuck in the past on grief, life never moves forward. We're constantly remembering events and circumstances that have already happened instead of still living life. And so, for parents, I remind parents of that all the time, that again, it's not necessarily that there's something wrong with your child. It's, are we helping them learn how to manage the things that are easy for them, the things that are struggles for them, and looking at how do we continue to build skills for them. And so again, that comes from a comprehensive approach where there's really got to be a collaborative effort in multiple areas where you're looking at where some of those things are. Like sensory input issues, like that becomes, these people have sensitivity to certain textures, certain foods, certain smells, light,
Sounds.
sounds, right? And so what do you do? Like, does that mean they can never go to a sports arena, or does that mean they can never go to a loud concert? No, it might mean they need some adaptive skills, or they need some tools that help them be able to function in those environments. So headphones, noise canceling headphones become a big part of that.
Okay.
Sunglasses or some kind of, eye vision stuff that helps kind of detect some of the lights where that might really bother them. You hear parents all the time of like clothing and things like that, and kind of changing what types of clothes they buy for their child. Foods, I think we often think of them as picky eaters, but again, it's kind of just trying to introduce different things to them and understanding what textures they kind of struggle with, and how we can avoid some of those things, or how we can incorporate that in different ways to help them kind of adapt to that. They also have, because of the gastrointestinal issues, they do have stomach problems often. And so looking at that, and then also sleep disturbances is a big part of that. And so looking at the environment of sleep and how do they sleep and what things can we do to kind of follow up on that, or get some help in learning how to change the environment where they can get good rest, because sleep is really pivotal and crucial for
For everyone.
neural functioning, cognitive abilities, and just
Right.
overall wellness and health. And so when you don't sleep well, that can have an impact on our mood, on our cognitive abilities. And so you really struggle without good sleep.
You mentioned the trait of picky eating. One of the studies that I read actually linked zinc deficiency, um, not causation, but correlation. Like, that was something that was common in kids with autism.
Yeah.
So interesting, some interesting information out there. And also, I mean, with every day, we're learning more and more and more. So, any parting thing that you want to say to those that may be watching?
Yeah, I think for me, again, recognizing that while they have challenges, I think there's a lot of strengths for individuals on the autism spectrum disorder scale too. Um, and there's a lot of different ways that you can look at kind of the process of treatment. And so in addition to kind of ABA therapy, or the applied behavior analysis,
Okay.
besides the testing and things that they can do. Oftentimes, teaching them some of the social skills or the empathy sometimes can also come through some animal therapy. So, like equine therapy is really great
Wow.
sometimes for
Yeah.
that. Because again, it works on being around
Mhm.
a horse and kind of grooming a horse. It works on riding with
Yes.
the horses and different things like that. And it kind of addresses a lot of anxiety. And so kind of being in a different environment there, looking at getting services as soon as possible. And so if there is concerns or we are noticing some of these things, I think for parents, the earlier you can catch it, the better. And so you want to be able to be aware of some of those symptoms, some of those things you're looking at, the repetitive behaviors, um, like hyper focus on just one interest or hobby. You want to look at some of the communication skills. How do they engage socially? And I think again, not every kid enjoys the same things, and so really it can be how are you working on identifying those individual characteristics and things that your child enjoys, while also looking at kind of broadening that a little bit.
Right. Parenting.
Mm-hmm.
It really is parenting. I mean, amped up a little bit, obviously, but it's the same thing you would do
Yeah.
with other
Yeah,
kids.
and I think years ago there was kind of this idea that the prognosis for autism spectrum disorder was like it's a lifelong thing, right? You're never going to get rid of it. And I think there's been more research and studies to that as well, that it doesn't have to remain as a diagnosis the same way ADHD doesn't have to remain a diagnosis, but oftentimes it does require a lot of work, and again, just repetitive work in terms of continuing to build skill sets where some of those things improve, and they wouldn't kind of meet criteria anymore for those symptoms. So, because again, some of those symptoms can be very normal um, in terms of when you're talking about developmental stages and what they're kind of dealing with. And so it's kind of, again, with autism, it's really got to be the level of severity and what are the levels of needs that that individual needs for support, because they typically look at it from there's three levels: level one, level two, level three. And each one is kind of level one's the earliest. They need some assistance. So, with some assistance and support, they can thrive in environments and do very well. All the way to three, which would be like nonverbal, they need total care. They need people to do things for them. And so, where do they fall on those levels? What kind of support do they need? And then, how do you build out that support for those individuals?
Wow. Super interesting and very helpful information. One last question. Is there an organization that offers a support group type setting for parents?
Is there an organization that offers a support group or peer support for parents?
Right. That
Uh,
you're aware of in the area?
there are a few throughout. Um, there are a few throughout the area. Project Hope does some
Okay.
things for children and adults. I don't know about if they have a parent peer support group for that right now. Um, there are a couple. There are a couple other groups like Autism Speaks usually has some information about
Okay.
like that where they can do that. We have in the past, even at Restoring Hope, tried to
Mhm.
establish some of that where we are doing more kind of peer support in terms of having parents come in and being able to just discuss some of the challenges and struggles or victories that they are seeing in kind of meeting their children's needs and kind of addressing some of those things. And so that's something we've thought about in the future. Again, kind of restarting.
Awesome.
There can be some individual organizations that also do that, but again, I think just reaching out to some of the larger organizations, Autism Speaks, Project Hope, they often have connections in that way. Um, and then there are some specific social groups and things like that that parents can look at, which I again I'll send you some resources on that can include those organizations, because I know that can be helpful when parents are struggling, kind of being in a room with other people who are going through
Right.
things and hearing that it's normal. Someone else is dealing with similar things,
Right.
but also hearing from others who maybe are a little further ahead
Hmm.
and have kind of done some of the work and kind of even helping push and pull some of those other parents to, hey, if you stay with this and you're consistent with this, and I know it's going to drain a lot of energy and take time and all of that, but they can see that there can be a different outcome and the prognosis can be very good.
That's great. That's great. So, John, how do people get a hold of you if they want to talk to you or come for counseling? What's the best way for them to reach you?
Yeah, so they can email me directly.
Okay.
Email at Restoring Hope is John, John, at arestoredhope.com. So there is an A in that. It's arestoredhope.com.
Gotcha.
Or they can call our office, which I don't have that memorized. So let me look up that number real quick.
Well, how often do you call it? You don't, right?
I recall the office number. No, that's the problem. They can call our office number 864 642 1171.
Okay, perfect. Great. I certainly appreciate your time, and all this information is super helpful. I know that I've already referred somebody to you for specific reasons. We were talking about that earlier. And I would just encourage anybody listening, if you have um, family members that may need some information or help with that, give John a call. He's well versed in what he's doing. And so again, we just thank you for taking time out of your busy schedule to come join us today. Will you come back for another one sometime?
I will be more than happy.
Awesome. Great. Well, thank you again, John. It was a pleasure to have you on.
All right. Thanks, Stephanie.